I'm washing my hands, knocking, coming in. I'm gonna provide some privacy. Hi, my name is Mackenzie and I'll be your nurse today. Can I have you restate your name and date of birth? Okay, good. I'm gonna log into the system here and check for any orders. And scan you in. Alright, so it does look like there is an order to put in an indwelling catheter today. So what that is it's going to be a little catheter that I'm going to slide up into your urethra, and that's going to help eliminate urine. So it shouldn't be too painful of a procedure. If it does hurt, let me know. Through here, I'm also checking. It looks like you should be physically able to help me if I do need that. Is that okay with you? Perfect. And do you have any allergies to iodine or latex? No? Good. Okay. Alright, so I'm going to go get that for you. Do you have anything else that you need? Before I'm going to get a sterile field ready, so I want to make sure that you have everything right now, and I'm going to also ask that you don't cough, sneeze, or kind of talk while I have that open. So you're good? Awesome. I'll go grab that. Okay. So now before I would do any sort of opening of the sterile field or anything like that, I would clean the perineal area with a warm washcloth. And with that, I would use a different side every time, going from the top to the bottom, going around and then down the middle of the meatus and the labias. So, yeah. So now we're going to put a blanket up here. Okay, I'm going to move the bed up so that I'm not hurting my back. And I would have had gloves on while washing, getting new gloves and foaming in and out anytime I left the room or anything like that. Okay, so I'm going to have you hold on to that while I pull under the under blankets. This is just to continually provide some privacy for you. You know, it's not a very comfortable procedure, but try to make it as comfortable as we can. Okay. That is down. Perfect. And we're going to lift up your legs if you can do that for me. Good. Perfect. And then I'm going to expose you here if that's okay. Perfect. So here we already have a chucks underneath. I would make sure that it's not soiled or dirty, and then leave that there, as we are going to put a sterile sheet over that anyway. So, alright, looks like everything is clean and dried. We want to make sure that it's sufficiently clean and dry so that we're not causing any further infection. So we're going to get our sterile field on. Make our little sterile triangle here. Perfect. So I did bring in an extra pair of gloves just in case I need it, in case the gloves are too big in here. And this part is leaning off. That's going to be the part that I can't touch or use. We're going to just not touch any of that. Going to lift this up and stay within that 1-inch margin. This is the sterile sheet that we're going to lay down here. If I could have you lift up a little bit. Perfect. Okay, so then now here, we're going to take our gloves. Start with our right hand. Perfect, so we have that. Now here, we're going to get rid of the fenestrated drape. We don't need it because our patient is a female. With a male, we would use it to kind of keep that space where it needs to be. So I'm just going to toss that over here. All right, I'm going to open this and make sure we have everything staying within that 1 inch margin. We do have everything that we need. We have our swab sticks, which I would open and make sure that those are ready for me to grab. Open up the lubricant and set that in here for me to be able to swipe the tip of that catheter onto to help insert. I'm going to take off the covering slowly so it doesn't slide anywhere. Good. Okay. I'm going to make sure that we have fluid attached so that we can blow up that balloon once it's inserted. Perfect. And everything here is ready, and here. So we're going to take these and move them over. Now I can kind of move this out of the way a little bit. Alright, so we're going to start with our swab sticks. So I would open those. I will not open them now just because they are running short on supplies. So I would open them and take a stick and open with my non-dominant hand and clean out on the left side. Throw it away. Grab a new one on the right side from top to bottom. Throw that away. And then the last stick, I would go right down the middle from top to bottom, making sure that we clean everything there. And then I'm going to get rid of this. We already have the lubricant in here. So I'm going to instruct the patient that once I'm ready to put the catheter in, I'm going to have you bear down. So you'll take a deep breath, and then you're going to push as if you're trying to go to the bathroom. So that's going to help reduce any pain or discomfort while that's going in, and it's also going to help make sure that it's being inserted into the right place. So make sure everything is ready for me here. Get some lubricant. I'm going to pull apart the labia. Make sure I'm within that 2 inch margin here. We don't want too much space there. Perfect. Okay, so you take your deep breath and bear down. It's being inserted. We're going to make sure not to touch close to there. We're just going to kind of string it through. Good. Went in 2 inches, so we're going to go in another 2 inches. Make sure it's properly in there. All right, so we've gone the proper 5 to 6 inches. I'm going to try with my dominant hand still and insert the fluid, making sure that there's no resistance or anything from this syringe. Good. Are you feeling okay? Good. Okay. So I'm going to tug here, make sure that there is resistance. Good. And there is. So I'm going to come through have the syringe there. I can take off my glove here. There those. And next we're going to attach the catheter to the side of the leg. I want to make sure that there's still going to be adequate room so that the patient can still move around comfortably. Perfect. I'm going to hang this down here. We also want to make sure that the peritoneal area is clean and dry. If there was need to dry out any of the chlorhexidine or anything else, we would do that and just make sure that it's all nice and clean to prevent that infection. And since it is nice and clean, we're going to get rid of this under her. And then we would get rid of this as per the protocol. And then we can let her lay down her legs, make sure that everything's not tugging and everything's good in place. Cover her up and give her back that privacy. Toss this. Cover her back up. Perfect. And we'll get rid of that as well. Make sure that there's no kinks in the catheter. Make sure it's held down below here on a non-movable part. Make sure that she's feeling okay. Lift up her head of the bed. Help things move by gravity. So lower the bed. Alright, is there anything else I can get for you? Here's your call light. Good. Alright, so I'm going to perform hand hygiene again, grab all my supplies, and leave.